Yes.
Hi, my name is Lad Himmelman, a Santa Barbara resident for many years. I'm sitting here with Dr. Fareed, and I'm happy to give this testimony to his work. I'm a quadriplegic, broke my neck in '85, pushed a manual wheelchair for many years, and finally my rotator cuff went out. The supraspinatus tendon actually broke off. And I was sent to the best, most highly reputed surgeon, shoulder surgeon in the West Coast at University of Southern California. He explained that I have to cut into my shoulder and take the tendon, like a 1-inch wide ribbon, and reattach it to the shoulder bone with 3 screws, which he did. Afterwards, I spent 4 months with my arm in a sling, and it was not easy to do if you have a manual wheelchair. You can't go very far. And then I had a month and a half of exercising with therapy, and it broke off back where I started from. And I believe that without a rotator cuff tendon, I couldn't be able to have any range of motion, and my life would be not very good. So back a second time, same exact routine, attached a different part of the tendon onto the bone, 3 more stainless steel screws, same 4 months in a sling. After therapy again, broke off a second time. And I believed I had to have rotator cuff to function. I researched and went to 3 other orthopedic surgeons to do that kind of work. Each one of them told me they couldn't do any more for me because the tendon was beyond repair, and told me that sadly I'd be having a frozen shoulder, and it would be pulling my elbow further and further towards my chest, and I wouldn't be able to extend my wrist out or hand out at all. I'd great pain even doing a little bit of that. I wouldn't be able to get my water at night, and let alone push a wheelchair or do anything active. Very sad. And then my general practitioner, Dr. Clement in Santa Barbara, told me of her husband, Bill Alton, a heart surgeon, who went to a Dr. Fareed in Montecito and had amazing results. So based on that, I came to see this guy. And right next to the Via Vi restaurant, which makes it even nicer to go see him. And I was surprised to see his little offices, his wonderful gal assistant, Jean. They took me in a side room, and he did a lot of manipulation of my shoulder, felt around there, asked me what hurt and what didn't hurt, and had a syringe with quite a volume of saline solution. And after finding the right spot, he filled the shoulder capsule with saline, quite a bit of it. Explained to me this would help lubricate the shoulder capsule and help the debris that was clogging the part of it to leave that pain area and find a place where it wouldn't hurt me. And the whole procedure was done before I even knew it. And they said to me, I go home and pull my elbows back behind my back, push my elbows back for a couple of days, several times a day, which I did. And I immediately had no pain, and full range of motion, which I said I could never have, behind me, over my head, as you see now. And that was back in 2002. And to the surprise of most of these medical people, I worked fine without this tendon being in place. I recommend many, many people with Dr. Fareed because he's the first one I came across in the medical profession who's common sense and simple practices to heal a non-healable problem. So I'm a living example of it. The friends I've recommended have had the same result. I can name anybody wants to call me. They call me and talk to me. Dr. Freed has my number. And after many years, now it's 2013, no pain again. I went back to him and said, I thought I had a lifetime guarantee. And he would honor that guarantee, of course. It only lasted for 11 years. But a small pain, I wasted no time at all trying anything else, right back to the source of my pain freedom. And this time, even with less difficulty, got rid of the pain again. Now I'm good to go for another long time. Who knows how long? But that's my experience, and I'm available to talk to anybody who has any doubts about this. Have a good day.
Thank you, lad. Just one footnote. You were kidding about the guarantee, were you not? Okay, thank you. That makes it better.